Assalamualaikum doctors. In this video, I'm discussing a recall communications that is about transition to the adult clinic. So the task comes like that: 14 years old boy who is a case of diabetes mellitus, who is now we want to transit the adult clinic and he is refusing. So as usual, IRCAP, remember one thing in these communications: do not mention in all the scenario the word that is kid. Always confirm of that he is a young man. So first, it is really my honor with an amazing young man like you. You know what they are telling me when I was coming in? They told me that you still sit with a very responsible young man who can take his responsibility of taking care of himself. Oh, thank you, doctor. With pleasure. I'm here to talk with you about some issues related to growing up. Would you like anyone to be here or shall we start? We can start. Actually, I heard you are a little bit upset. Yes, I'm upset because I did not want to go to the adult service. May I know why? Actually, I want to ask you why you are kicking me out of here. Actually, because you are growing up, you are becoming a man, and we are just kids doctors. Soon you will have questions which we do not have answers. For example, questions about relationship, questions about adult life, questions about career. We do not have any answers for this. Doctor, you can Google these questions and answer me. Okay, thanks for your advice. But I'm talking about the medical experience to give you right medical opinion. We do not have enough experience to deal with growing ups. We can just deal with the kids, not growing ups. Okay, doctor, I have been following up of the last 6 months of my life, and all of a sudden you kick me from here. First of all, we are not kicking you. We are just transferring you. But it is not a sudden process. It is a very gradual. It may take a month or even years to be transmitted to adult service. But they did not anything about me. They did not know anything about me at all. How can you transfer me to them? Let me reassure you that only you will be transferred there when they know everything about you. When you was diagnosed, how many times you are admitted, will transfer you till they know everything about you. Okay, doctor, but if I got sick, I will be lost in between during this transition. Definitely no. You will not be lost. You will be admitted there if they know and they know everything about you. Okay, doctor, but I love you. Actually, we like following you up and we like taking care of you. But we want the best for you, and this will be transferring to be followed by adult doctor. One of my friend was transferred. An old man died in same rooms in middle of night. It was so scary. I do not want to have this experience. Oh, I can understand. This can be scary. That is why you will be the first transmitted to young adult clinic. Are you gonna force me? Definitely no. But we are sure that you will ask for these transmissions as you will have questions we do not have answers for you. Okay, can I bring my ma'am with me? If you want, she is more than welcome. But I'm sure at some point you would like to be alone. I will give you some trusted website and written leaflets, and if you want, I can attach you to a group of boys a little bit older than you. They have gone through this transmission and they are happy and satisfied about service there. Then summarize trusted website leaflets these are. So I'm telling the transmission to the adult service. It also comes with the medical student. So they want to know the age these are. So first we should be aware about the transition pathway or transition process. As usual, others medical student we are RCP we are telling, and first stage 12 to 14 years. So 12 to 14 years what we do there, who will be pediatricians, where pediatric clinic. What are they doing? Preparation for transition of giving him leaflet, discuss with him, giving leaflets, discussion of the leaflets in next meeting. So 12 to 14 years age old, where pediatrician will look, pediatric clinic also follow up, and that time just we give the leaflet, these are we are giving. Then when 14 to 16 years age old, so 14 to 16 years age old, there are both pediatrician and adult team will be involved, where the pediatric clinic. What are they doing? Screening for complications, making sure he can take care of his disease. For example, in case of diabetes mellitus, he can measure his blood glucose, take insulin by himself and can detect signs of hypoglycemia. So that is 14 to 16 years age old, both pediatrician and the adult clinic and the pediatric clinic, the locations where they will know about the complications. The like example I'm giving, like diabetic child, he know how to measure the blood glucose level, how to take insulin. These are will that and the sign of hypoglycemia. Then about the 16 to 18 years age old, who pediatrician and the adult team, where adult clinic. What are they doing? Sharing the database, discussion of adult issues as smoking, alcohol, drugs, driving license, traveling, sport, OCP, and pregnancy. So 16 years age old, we understand that is both again pediatric and the adult team and adult clinic. This is adult clinic. As 18 years age, he touched. So what are they doing? Sharing the database, like discussion of adult issues as smoking, alcohol, drugs, driving, traveling, sports, OCP, and pregnancy. For stage 18 to 20 years, transferring to young adult clinic with revising the previous steps with adult clinic team. Fifth stage is more than 20 years in adult clinic with giving feedback for a while to the pediatrician and no more follow-up. So there are 5 stages, we understand. 12 to 14 first stage, 14 to 16 second stage, third stage 16 to 18 years, then fourth 18 to 20 and more than 20. But 18 to 20 we are transferring to the young adult clinic with revising the previous steps with adult clinic team. Okay, 18 to 20 years we are transferring. More than 20 years it is always on the adult clinic giving feedback, everything doing. Just after 18 to 20 years we are young adult team we are giving. So this is about transition to the adult health service communication. Thank you.